Indiana has in fact received its first case of coronavirus COVID-19.
Today, new cases in our state topped 8,000.
What could be the beginning of the end of the pandemic.
The FDA has granted emergency use authorization for Pfizer's COVID-19 vaccine.
To a nation waiting for action, help is on the way.
There's no secret. We've had a lot of divisiveness. It's got to be science is driving what we're doing.
Good evening to you, and thank you for joining us tonight for our special presentation, A Shot of Hope, Vaccine Facts and Fiction.
We're approaching a year since the coronavirus pandemic hit Indiana. And though the promise of a vaccine offers hope for a return to normalcy, there are many Hoosiers reluctant to take it.
Well, tonight we're digging deeper, talking to health experts who address your questions and concerns. We'll also talk to those who have had the vaccine and those who have helped to distribute it.
And lastly, what's in store for the future under a new presidential administration and as more vaccines become available to all age groups.
But first tonight, the basics. How does the coronavirus attack your body? Here's what you should know.
Viruses are incredible little machines. They come in all shapes and configurations. Some look like robot spiders. Others, like coronavirus, are spheres with spikes on the outside. Remember that for later. Viruses, though, have a problem. They can't reproduce on their own, so they look for hosts. In the case of the novel coronavirus, that's you. The virus particles are inhaled through your nose or mouth, and they get right to work, looking for lung cells and similar tissues. Once they find their target cells, they use those spikes I mentioned to latch on. The virus penetrates the cell wall and injects its genetic material called RNA. RNA is a set of instructions, like an iPhone update, which reprograms your cell to make more virus. And soon, those new viruses pop out, ready for you to exhale, launching them into the great big world so they can infect someone else. And the cycle continues, and continues, and continues, unless the virus particles are stopped by masks, slowed by social distancing, or potential hosts are vaccinated.
Now that you know how the virus works, we can show you how the vaccine fights it. Both Pfizer and Moderna's vaccines work in a very similar way, and since they're available now, we'll focus on them.
A vaccine is a medicine that prevents illness by tricking your body into thinking you've been infected. Vaccines do this in different ways, and there are 3 types being tested for use against coronavirus. Let's talk about the one type being used right now, made by Pfizer and Moderna. It's called an mRNA vaccine, and it teaches your immune cells how to make a harmless little piece of coronavirus called a spike protein. It's the spike protein we mentioned earlier that helps a virus particle latch onto your cell. Once your immune cells make these little pieces, your body learns to recognize them as invaders. Within weeks, an army of special cells programmed to hunt for spike proteins is constantly on patrol. A second dose, about 3 weeks later, gives your system an extra boost. Then, if coronavirus enters your body, the army of soldier cells attacks right away. Coronavirus doesn't have a chance to make you sick. It's important to note that mRNA vaccines do not contain the virus. If you feel symptoms after you get your shot, it's because your body is learning to mount an immune response. It may be uncomfortable for a day, but doctors say it's good news.
Yeah, Krista, when Reed Steffen and Jessica Taylor yesterday got a chance to be the first out of the gate in getting the vaccine at the Miro Center that you see behind me, they did not hesitate. Steffen, a patient care technician in Parkview's Progressive Care Unit, is believed to be the first Hoosier to get the Pfizer shot following shipment of the vaccine on Sunday.
I'm imagining that you've got to be taking home a lot of emotions after you get done with a 12-hour shift working directly with those COVID patients. What's that been like?
Yeah, a lot of emotions. Every single death that I've dealt with personally, I carry that on my back every day. I still remember a lot of their names, and that's really tough. Because sometimes you think about them Sorry.
It's okay.
And you know, you can't really talk about it besides other than with your coworkers who were with you at that time. So it's been extremely hard having to try to forget about that. But you just don't, and every single one that you deal with, you know, it comes back, and it's just more and more every time. But you know that you're there for their family and for them.
You were fine, like day after you got the first dose. You said, I think, that you didn't even have pain in the arm. What was the second dose like?
The second dose, the only thing I had was just arm pain, but nothing else at all.
And has that been the experience of your colleagues too?
My colleagues, I have heard they have had temperatures, they were sore, a little fatigued too, but nothing out of the ordinary of what we expected already, and nothing to the extreme point of having to call off work. So,
Worth it.
worth it, yes, very worth it.
Have you felt like a shift in the mood at work now that more people are getting the vaccine? Is there hope?
Yeah, there is a lot of hope. The difference now is that we're seeing lower numbers coming through, and I don't know if that's a direct correlation because of the vaccine or not, but we're hoping in the coming months that will be an even lower trend. But the mood is definitely up. There's hope, but there's still a lot of work left to do, and I think everyone knows that, and all the nurses understand that too.
Parkview was among the very first hospitals in the country to receive the COVID-19 vaccine. Meanwhile, Adams Memorial Hospital serves a more rural community. We sat down with CEO Dr. Scott Smith, who shares his perspective on distributing the vaccine.
Is there anything you think about a rural county in general that is more challenging when you have a pandemic and when you have a lot of misinformation spread on social media and people reluctant to believe that it's real or believe that it's as bad as it is?
I think those things are challenging for big communities and small communities, really, and again, partially because of social media and because of the way information is shared so quickly. I think that the challenge for each of the counties in Indiana and rural counties was that we were hearing information from so many different sources. So elected officials at the state level, national level versus the local level, it was very difficult for all of them to be on the same page. So then the same thing happened in the community as well.
Has the community been eager to get vaccinated?
I think it was very impressive when Dr. Weaver and Governor Holcomb announced that 80 and over could get the vaccine. And the senior members of the community flooded the internet and the schedule. Very impressive. And then 70 up as well. I think that healthcare workers have embraced the vaccine, but I am ready for them to embrace it even more.
Where do you see vaccine distribution going from here? Are you confident that the hospital will remain the vaccine clinic, or at least continue to be a distributor for the foreseeable future?
Yes, I am. And we get updated information from the state, sometimes daily, but at least weekly. And so we make sure that we have team members from the vaccination team on those calls to see, what's the plan going to be for next week and the weeks to come. And I really think that for now, we can plan on our vaccine supply being stable. I don't think that there's much plan that we would expand that capacity in Adams County based on the vaccine allocation from the state. But I also don't see it dropping. Sometimes we've had to adjust hour by hour during the pandemic, sometimes day by day, sometimes week by week. And right now the vaccination status is week by week.
Much more when we come back tonight. You asked, they answered. The Allen County Health Commissioner and the Noble County Health Officer address your questions.
Hi, and welcome back to our special program, A Shot of Hope. Vaccine, Facts, and Fiction. And this part of our program is really the meat of it, where we get to talk to some of the experts, some of the people on the front lines of this pandemic here in our part of Indiana.
Tonight we have Dr. Matthew Sutter, the Health Commissioner of Allen County, and we have Dr. Terry Gaff, the Health Officer of Noble County. Doctors, thank you for being with us tonight. We have questions from many of the folks at home. Let's get right to them. Dr. Gaff, we'll begin with you. A question from Kazette. She says, I'm hearing from nurses that you can get very ill from the vaccine. What do we know about side effects?
Well, I think that it's almost universally found that the second vaccine dose gives more of a reaction than the first vaccine dose. The first vaccine dose seems to be fairly well tolerated, and the second gives a varying amount of the response that has included low-grade fever, fatigue, joint and muscle aching, and even some nausea. But what we can say is that that kind of reaction is an indication that their body is actually creating some immune response, and so it's not all a bad thing.
And Dr. Sutter, I'll direct this question to you. We had a woman named Nicole write in, and she says she's a parent to a preemie kiddo. He's 7 now. She's not sure if it's safe for him to get the COVID vaccine, but she says she doesn't believe he would survive COVID. A lot of difficult questions coming from folks in incredible circumstances. So what about those high-risk children? What would you say to Nicole as a mom?
So it's a difficult thing because the vaccines have not yet been tested on children. That's starting now, and in the early phase 3 trials, we're seeing now down to 12 years old, but nobody as young as 7 has really had this tested on them yet. Until that's happened, we wouldn't recommend getting the vaccination, even if they're otherwise high risk. The good news is that many people who would be normally high risk for things like influenza, which would be young kids, don't seem to be as at risk for COVID-19. There's really an incredible age distribution for this. And the older you are, the more likely you are to have severe illness, hospitalization, and death. So unfortunately, even though at some point we would like to get that young child vaccinated, now's not the time.
Dr. Sutter, this question is from Tom. He asked, how long is the estimated immunity gained from the vaccinations? Do you think it'll become an annual thing, like a flu shot?
Yeah, well, the short answer is we don't know exactly how long the immunity is going to last. In fact, we don't know how long natural immunity really lasts, just because the virus is too new. What we generally know is that we expect it to be better than natural immunity, which is really good immunity for about 3 months. We don't know, most people probably have longer immunity than that. The best guess is probably around a year, maybe 2 for most people. There'll probably be a couple of outliers who maybe could get reinfected earlier. But the really good news about the vaccines that we're seeing right now is that they're just spectacular at helping severe disease. So even if the immunity allows you to become reinfected, perhaps in a year or so, we expect that it will be a much milder illness, much less likely to require hospitalization or oxygen or a ventilator.
Dr. Gaff, we have a video submitted question from expecting mother Mary Larson, who's due this month.
My doctor was very open and candid with me regarding pregnant women and babies not being included in the vaccine trials. So what information is there available right now regarding the vaccine in young children? And does the vaccine have any effect in breast milk if I get the shot?
I think that that's a legitimate concern. However, largely it has not been studied adequately. There are people who have become pregnant during the time when they were in the phase 3 trials of the vaccine. And thus far, we haven't seen any problems with either pregnancy or with lactating mothers. But the jury's still out because there just isn't enough data to make a decision. I know the World Health Organization came out today with a concern about giving the vaccine to pregnant ladies, and it's not been approved for children at all.
And we have one more video question. This one's for Dr. Sutter from Lori Lynn. Here's what she wants to know.
I hear there's sometimes extra vaccines that aren't getting used because people haven't shown up for their appointments. And I'm wondering if there's any way we can get on a list for getting scheduled to just be called if there are some extras. Thanks.
Because the Moderna vaccine comes in packs of 10, we'll sometimes have, one or two, maybe as many as 5 doses left over. Our first priority is to not waste any vaccine. This is a precious resource. There's not enough of it to go around right now. So we want to make sure that none of it ends up in the trash. So in Allen County, we already have a list for this. We're not accepting names for that. Our priority has been the volunteers and staff that are directly helping our vaccination effort. As more vaccine opens up, there might be opportunities. Some counties are doing that, but for Allen County right now, that's not possible.
Dr. Gaff, Melissa wondered this. Do people who already had COVID-19 need to get the vaccine?
We recommend that people who have had COVID-19 go ahead and receive the vaccine. We're not really sure whether they get complete immunity from the disease itself and how long that immunity might last if it is present. We know that the vaccine provides 95% efficacy, and so at present it's recommended that people who have already had the virus receive the vaccine. However, they may choose to delay the vaccine or in order for others who are more vulnerable to receive it first, in that they may be protected to some degree by the immune globulins that they and immune response that their body has produced in order to combat the infection.
Dr. Sutter, we've had several questions from people who are concerned about those with underlying conditions. Lori is one of those people with a question like this. She wrote, "Why isn't the state opening up the vaccine to people with underlying conditions when the federal guidelines indicate that people with those conditions should be eligible for the shot?"
Some states have chosen to go that way. Indiana has chosen to go with healthcare workers first responders, which are relatively small groups, and then the first large groups are really over 80 and then over 70. The idea for that was this seems to be an age-related disease in terms of severe disease. So there's a very clear thing that the largest risk factor is age. It's also the easiest to be able to prove or disprove. So we don't have to have people showing proof of different comorbidities or proof of different problems. It's very clear what somebody's age is. So the goal is first to get everybody over 60 who wants the vaccine, and then open it up from there. It's not completely clear who that next group will be. It may be essential workers. It may be people with who have risk factors that make them more susceptible for COVID who are under the age of 60. Understand that that's a very large group. That's essentially a third of the population. And right now, there's just not enough vaccine to go around.
Dr. Sutter, we have a question from Valeria. She says she's conflicted on getting the vaccine, and for a few reasons. She says, "I'm an African American, and I know the medical atrocities, the medical experiments done on my race of people. I'm suspicious on the speed to which this was developed and the long-term effects of the vaccine." What would you say to her?
Yeah, well, it's especially important from my perspective for people of color to get the vaccine because they're at higher risk for having serious disease, hospitalization, and death. So I would encourage her to get it. Now, many people are concerned about the fact that this has been developed very quickly, and it has. In fact, it's truly a medical miracle that we have 2 highly effective, safe vaccines this quickly. It's never happened before. But it was built on 20 years of research of figuring out how to make vaccines quickly, how to make mRNA vaccines in particular, and other vaccines that are currently in the pipeline. So even though it was done quickly, all the steps were taken, all the care was taken. What happened is all the gaps in between were taken out. So nothing was taken out of the phase 1, phase 2, or phase 3 trials. It's just that normally there are months to maybe even a year gap between those trials because they're expensive. But in this case, there was a lot of funding for it, and all of them were put together. And in fact, while phase 3 was going on, they were already starting and ramping up manufacturing production. Totally unprecedented. We've never done anything like this, but it's a really deadly virus. More than 400,000 Americans have died of this so far, and maybe another 100,000 will yet this spring. So for all the people who are concerned, I hear that. I know that it's hard to trust some of this stuff, But we have gone from having trials of tens of thousands of people to having now 20 million Americans with their first dose of vaccine. So we're getting plenty of experience with this. You're not going to be the first one to get the vaccine at this point. You're not even in the first 20 million. And people of color, minority communities are much higher risk for having serious disease. So it's really important they consider getting this vaccine.
And now I want to give you each a chance to weigh in, and we'll start with Dr. Sutter. But I want to ask both of you, is there one bit of misinformation or something you've seen floating around out there that isn't true that you'd like to address? Again, Dr. Sutter, let's start with you.
You know, one of the things that people are worried about is whether this can cause infertility. That's probably the one that's had the most traction, especially with young women who might be thinking about getting pregnant. And there's no evidence for that. There was one report that came out that questioned whether it was a possibility because one of the antigens with the vaccine can look something like an antigen that's involved in fertility. But understand that's exactly like the COVID-19 virus or SARS-CoV-2. So if there were any infertility issues, we would also see it with natural infection. And we've been seeing people with infection. We don't see any of that right now. I would urge almost everybody, when you consider risks and benefits of the vaccine, people are very focused on anything that might go wrong with the vaccine, but they're not balancing that against the risk of getting a COVID-19 infection itself.
The original idea that any part of this is a hoax or that it's no worse than a cold or even the flu has hopefully been debunked pretty thoroughly. However, I understand that an individual may only experience a small, even no symptoms, and thereby think that the rest of the world is going to experience the same thing. Those people become a reservoir of the virus and the potential super spreader. And I wish that they would take it seriously and understand that they're putting other people in danger. And so this is not a hoax. It's not political. It has nothing to do with that. And that we all need to work together in order to combat this deadly problem.
All right, Dr. Gaff of Noble County, Dr. Sutter of Allen County, we want to thank you both for answering those questions. We certainly appreciate it.
And we have much more ahead on this special program when we return, the future of the COVID-19 vaccine. When will we see more companies making it, and how will vaccines be distributed closer to your home? And finally tonight, the future of the COVID-19 vaccine.
As more manufacturers plan to roll out the immunization, the nation's top health experts hope the pandemic will come to a close later this year. Late January, Johnson & Johnson released the phase 3 global results of its vaccine with only one shot needed. It was shown to prevent moderate disease by 66% and was 85% effective against severe disease. Dr. Anthony Fauci, the director of the National Institutes of Allergy and Infectious Diseases, listed several benefits to that vaccine, which include more convenient storage like refrigerators. He says it costs less, and again, it's only a single dose. U.S. has already secured 100 million doses.
We spoke with representatives for CVS who tell us they are ready to roll out 20 to 25 million shots every month, and they say they believe their competitors are as well. CVS Chief Medical Officer Troyan Brennan recently said they're waiting on the president and an adequate supply of vaccines to begin administering them.
And the Biden administration is trying to decide when they open up that federal program. And you really want to open that up as there's a reasonable amount of supply available, because we don't want to frustrate people by saying we have some vaccine, but it's only a few stores and it's only a few vaccines per store. So it's all going to depend on how much vaccine is available from the manufacturers. And I know they're working as hard as they can to pump out those vaccines.
CVS representatives tell us timing is fluid. Knowing just when and how vaccines will be distributed to the public varies state by state and depends largely on supply. Other pharmacies like Kroger, Meijer, and Walgreens are planning to distribute the vaccine as well.
At the beginning of the month, Dr. Fauci said if Americans want to move past the pandemic as early as later this year, the majority will need to get the COVID-19 vaccine.
As I had mentioned, if we can get past vaccine hesitancy and we efficiently and effectively get people vaccinated to the tune of maybe 70 to 85% of the population by the end of the summer, the beginning of the fall, then we will have gotten herd immunity, I believe, namely getting that blanket of protection over the community.
And thank you for joining us tonight. We've shared all of our COVID-19 vaccine resources on our website, WPTA21.com/vaccine.
Have a good night.